How can we use exercise therapy for the orthopedic disorder? You look similar right now with the glass. Okay, you are familiar. I mean, you are familiar right now. That was the point. They are different with the past. Okay. Exercise therapy. How many exercises, how many type of exercises can we use? And why we use the exercise therapy?
We have two, passive and active.
I know, I'm not talking about the general concept. I mean, when we are talking about the exercise therapy, there are different type of exercise therapy. You're learning part of that, and you are trying to learn the other parts. It's okay. This is an ongoing stage, ongoing knowledge. It's okay. But the goal of the issue refers to the ambition you have.
Stretch, exercise.
Okay, they are tools. You have 100 tools and you want to use it to reach the goals, to reach your goals, including exercise, a stretch, a strengthening exercise, concentric exercise, eccentric exercise. You know the difference between the concentric and eccentric? You know that? Okay. Isometric exercise,
Yes.
okay? Or probably some techniques, specific techniques such as mobilization
Yes, mobilization.
or manipulation. This is too young, too soon for you for manipulation. It's not work. But mobilization is correct. Okay, but all of them and all of the electro devices, hence electrical stimulation, dynamic, ultrasound, shorter determine. We bought shorter determine for you in the clinic. You have it.
Yes.
Okay, all of them are tools. You're using the tools to reach your goals. What is the goals?
Range of motion.
Repeat the normal function.
Increase pain. Decrease
Pain,
pain.
function, very simple in your mind. Pain, function, processing, increasing healing process. But when you are not talking about the pain, it's pain. When you are talking about the function, including range of motion, increased power of the muscle, increased ability of the transfer or something like that, they are all function. Okay, and they can help any of them. I mean the tools. Okay, how many exercises does we have? Range of motion exercise, a strengthening exercise, increased power of the muscle. Okay, how many stages does we have in a muscle? Dr. Rahim?
Five.
Five.
Yes.
Okay. Is it possible to increase power of the muscle grade 4 to grade 5? Yes, why not? With some strengthening exercise, concentric exercise. Okay, what about 3 to 4? A little harder, but yes. 2 to 3,
Yes. No.
harder. 1 to 2, not really. So, you know, the increased tension in the power of the muscle, it's not, how can I say? It's not 1 plus 1. It's not based on the calculation. It's based on the geometry. We call it hendese, probably is the same in Arabic. It's not, you can work on 1, maybe to 2, because you don't have anything here, just some fibrillation. It's not possible to make it to 2. But easy, you can change it 4 to 5, because you have lots of fiber of the muscle with a high quality of the contraction. But for 1 to 2, it's not possible. 2 to 3 is very hard. It's very hard because there are just few available muscles. Okay, 3 to 4, it's better. Did you get my meaning? So when you don't have anything, you have just some fat, some microfiber, that's it. How can you make it bigger? How can you make it much powerful? Is it possible? Okay, we call it adding geometry instead of adding calculation. Adding geometry. Okay, a strengthening exercise. How many exercises does we have? Simple exercise. Isometric, concentric, eccentric. Which one does have higher tension? You know the meaning of the difference? Isometric, concentric, eccentric. You know the differences? Eccentric, okay. How can I check? Isn't there any pain here? No. Okay. This is concentric. Shortening length of the muscle, concentric for the quadriceps. Okay. This is eccentric. Lengthening at the same time making tension. Did you get my meaning? Both of them is flexion extension of knee. Both of them is flexion of knee. Okay? It's flexion. Concentric or concentric for forceps, concentric for hamstring. Concentric for forceps. It's shortening. Concentric for hamstring. What about lengthening? Eccentric. Eccentric for forceps, lengthen. Eccentric for hamstring, they are lengthening. Actually, in a closed circuit, it's eccentric control of flexion with eccentric tension in forceps, because it's control the work. Okay? And what about the isometric? You know that, like a palm. Okay, which one does have higher tension? This is a point that probably you read it in exercise therapy. Which one does have higher tension? The highest tension refers to eccentric. Eccentric, higher tension, then concentric, then the lowest amount of tension is for isometric. So that means actually the isometric leads to lowest amount of increasing a strengthening muscle. You know the meaning of a strengthening. Let's use this term. A strengthening of muscle. Okay. If you are using isometric, ask the patient, provide quad set. You know the meaning of quad set, isometric. 1,000 times, 100 times. So how much it increased the power of the muscle? So low, because the tension is not too much. When you compare it with concentric, okay, in concentric the tension is going to be a little higher. And the best amount of the tension you see, you can find through the eccentric with higher length. So you can start with isometric and then a little higher tension concentric and then eccentric. Okay, and the highest amount of the tension is in eccentric. So which one make your muscle much powerful? Eccentric, which provide higher tension. When you want to start with lower tension, which one do you prefer? It's initial step. The fiber is too weak. So you started with eccentric. It's not possible. It's not possible. They cannot control it. They follow it. So you started with the simplest one, the isometric. The middle stage, concentric. In the later stage, eccentric. So you don't want to start with the eccentric, the most actually powerful one or the most complicated one. Eccentric belongs to the later stage of the treatment. Okay, there are strengthening exercise, high performance exercise. Let me review it. Functional exercise, conditioning exercise, PNF, stretching, mobilization. One by one. Range of motion exercise, we review all of them. Range of motion exercises including active, passive, assistive, and continuous passive motion. You know the continuous passive motion? You know the continuous passive motion?
No.
It's kind of a device, it's a kind of electro device, but it's mechanical. Such a kind of mechanical device in this way. For instance, after surgery, after knee surgery, after ACL surgery, put the lower extremity on this device, set the range through, for instance, 10 degree to 30 degree, and generally it makes changes just that the range of 10 to 30 degree every day, for instance, for 10 times or for instance, 15 times. It's a kind of assisted range of motion device, but in a mechanical way and without any tension, any intention of the patient. It was happened by electrotherapy device. We call it CPN, continuous passive motion. This kind of device. Okay. They are using for the range of motion. Active, passive, active assistive, and continuous passive motion. Okay. There are some advantages and disadvantages. I don't want to give it to you. For instance, when you have a continuous passive motion, what is happening? Your joint going to be moved, so there is some secretion on there, better food transformation, transdiction, and also the oxygen or something like that, and decreased risk of adhesion or something like that. They all belongs to the course of the exercise therapy. Don't need to focus on that. Okay, there are strengthening exercise, including the isometric, isotonic, isokinetic. So we told you isometric, it's very low amount of tension. Isotonic is 2 branch, concentric, eccentric, and the concentric is middle tension, eccentric, high tension, and you know that the symbols. What about the isokinetic? What is the meaning of isokinetic? No. Odds. What is the meaning of isokinetic? I'm not sure. Have you been in pool? Pool, you know, swimming. Imagine your hand in the water. Okay, you push the water.
Yes.
You move it slowly, and the water try to keep your hand slowly. Okay, you move it faster. The water resists against you. You move it faster.